Personalised medicine, I think Dave also alluded to this in his talk. This is where we are applying the genetic information that we have to predict either the development of a disease, influence decisions about lifestyle choices, and tailor our treatments to each individual patient. So let's give you an example of, this is another cool name, ice cream. So this is a study which is the idea of an Australian, so Eva Segalov is the main investigator in this study, in collaboration with a number of other investigators around Australia. But essentially what this study is looking at is once again the drug cetuximab, which I've just spoken to you about. We know that cetuximab can help those specific patients who don't have the mutation in KRAS when we use it kind of towards after patients had a lot of treatments for their bowel cancer. We also know if we combine cetuximab with chemotherapy that it can be beneficial when we use it after patients had 2 lines of treatment for their bowel cancer. But we don't know whether or not just giving the cetuximab alone or giving it with the chemotherapy is the best option. And we don't want to have to give it with the chemotherapy if we don't have to. So this study is designed to try and work that out. But they did something even better than that. They've actually looked at specific groups of patients who have no mutations in a whole number of genes. So not just that KRAS one we've just learnt about, but also NRAS, PIK3A, BRAF, and all sorts of other fancy names. So they're trying to find those patients that are the most likely patients to benefit from the drug. And that's really personalised medicine. Like the picture that Dave showed, we can actually then pick out those patients and say, look, this is the drug for you. And that would be great, that we would be able to give each patient that we see with cancer a specific drug which is likely to be of benefit to them. So this study started in March 2013, and we are proudly involved in this study. And I think we need only 8 more patients Australia-wide to answer this question. So they've done a tremendous effort, and this will be the only study in the world to answer this question. So once again, a pretty amazing effort by